Slide, Portfolio Overview, Structure, Function, and Diseases of the Cornea. George McKie, DVM, PhD, DACVO, Program Director, National Eye Institute, NIH. Presentation to the National Advisory Eye Council, June 17, 2022.
So thank you, Kathy, for introducing me. As she mentioned, I'm George McKie, and I'm the Program Officer for Structure, Function, and Diseases of the Cornea portfolio here at the extramural NEI.
Slide, Highlights of Portfolio.
And I'm going to highlight these aspects of the portfolio for you today: corneal structure and function, preclinical and clinical corneal diseases, and future directions for our portfolio.
Slide, Corneal Structure and Function.
So the first area is structure and function of the cornea, and I want to give some examples of applications that we have that fall into this area. We have applications looking at extracellular matrix structure and how they affect differentiation, contractility, and patterning of corneal keratocytes. And techniques used in this include mimicking the 3D tissue environment with cell culture models and using multidimensional imaging methods in vitro, in situ, and in vivo. We also have applications focused on homeostasis of the cornea. For example, how corneal nerves mediate different aspects of the immune system. And they're using models of corneal nerve damage with dry eye disease and allogeneic corneal transplantation, and single cell real-time PCR and flow cytometry to do this. And we also have applications looking at maintaining corneal transparency. For example, the role of membrane transport proteins, and I listed two of them here, in maintaining corneal transparency. And they're using techniques including transgenic mouse models, cell cultures, and imaging methods.
Slide, Corneal Diseases, Preclinical Studies.
For preclinical studies in corneal diseases, I bin them into a variety of groups just for my own method of binning them. We have applications looking at wound healing, for example, microRNAs regulating homeostasis, extracellular matrix on corneal epithelial development, migration, proliferation, and differentiation of epithelial cells, transcription factors in diabetic wound healing, and the role of exosomes in diabetic and regular wound healing. We also have a variety of applications on infectious diseases, and this covers a whole spectrum of infectious disease between bacterial, fungal, and viral. And most of these applications are looking at how the infectious agent enters the cornea and causes pathology, or drugs or agents to treat these processes that cause the pathology. In this portfolio, we have applications in limbal stem cells, but for this part of the portfolio, they're basically isolating and cultivating the limbal stem cells for future, getting them ready for future clinical use.
Slide, Corneal Disease, Preclinical Studies Continued.
And we also have applications which I've been into something I call structural, because these are diseases that affect the overall structure of the cornea. For example, keratoconus, we have an application looking at prolactin-induced protein modulation serving as a biomarker for keratoconus onset and progression. Looking at genetics of Fuchs endothelial dystrophy, and even lysosomal storage disease dystrophies. So if you recall, Fabry disease is a disease where you don't have the appropriate enzyme to break down fats and lipids in your body, and this causes a lot of ocular comorbidities. And this particular applicant has access to a large Fabry patient cohort and an animal model that recapitulates the ocular symptoms, and they're hoping that they can elucidate a time course for causing ocular pathology in Fabry patients. We also have an application looking at Down syndrome and the role of gonadotropins in the Down syndrome population. So they believe that in people with, or in younger patients with Down syndrome, that you can predict their risk of getting keratoconus based on the level of sex hormones in their body.
Slide, Dry Eye, Preclinical Studies.
And I separated out the dry eye preclinical studies simply because I think dry eye is an important part of the portfolio. And in dry eye, we have applications focused on the lacrimal gland, for instance, higher breath growth factor signaling in the lacrimal gland, and understanding immunopathogenic mechanisms, like the role of regulatory T cells and memory Th17 cells in aging population who develop dry eye. And we also have applications looking at treatment for dry eye. We have lacitrin, which is natural chia protein, and ocular surface immunoglobulin eye drops, which is formulated from pooled human immunoglobulin products. And both of these treatments are being shown to be successful for severe cases of dry eye. And as part of the anterior segment initiative, which Dr. Chang has referred to a couple of times in his introduction, we have released a notice of special interest,
NOT-EY-21-07,
looking for the identification and development of new biomarkers and effective methods to treat and diagnose dry eye disease.
Slide, Corneal Disease, Clinical Studies, Seasonal Conjunctivitis Outbreak Reporting and Improved Outcomes, or SCORPIO.
And I'm going to switch to clinical studies in corneal disease. And one of the clinical studies I want to highlight is Seasonal Conjunctivitis Outbreak Reporting and Improved Outcomes. And this is a large ongoing international collaboration with the goal to identify pathogens, pathogen evolution, global trends, and immune responses involved in the epidemiology of conjunctivitis to improve clinical outcomes with the potential to personalize individual patient care with conjunctivitis. And their aims, they're determining how adenovirus genome types vary from region to region, identifying emerging causes of seasonal and epidemic conjunctivitis, and identifying local immune response signatures of children and adults with infectious conjunctivitis.
Slide, Corneal Disease, Clinical Studies, Mesenchymal Stromal Cell Secretome for Promoting Corneal Regeneration.
Another clinical trial I wanted to highlight is Mesenchymal Stromal Cell Secretome for Promoting Corneal Regeneration. And this is an ongoing clinical trial with the goal to accelerate corneal wound healing and limit unnecessary inflammation and secondary scarring.
New treatment approach.
And they're using Mesenchymal Stromal Cell Secretome as an eye drop to accelerate corneal wound healing in patients with non-healing corneal wounds. And they are starting to enroll patients this fall. So they haven't started yet, but they've got FDA approval and everything. They're starting enrolling patients this fall.
Slide, Corneal Disease, Clinical Studies, Cultivated Autologous Limbal Epithelial Cell, or CALEC, graft.
And the other clinical trial I wanted to highlight is Cultivated Autologous Limbal Epithelial Cell grafts. And this is an ongoing clinical trial with the goal to rebuild a healthy surface for the damaged eye using cells from the other eye. And this avoids immune system issues from donor grafts. It's only useful in unilateral diseases, though, like severe ocular burns or so forth, because they take healthy limbal epithelial cells from the fellow eye and grow them in FDA-approved amniotic membrane to put back in the damaged eye to recreate a healthy surface in that eye.
Slide, Encouraging Trends and Future Directions.
And I just want to highlight encouraging trends and future directions that the portfolio is taking. And Dr. Chang talked a little bit about some of these workshops, so I'm hoping he didn't steal my thunder here. There's two workshops that occurred last year, one on the immune system and eye health and one on the microbiome. And the immune system and eye health workshop was titled Immunity and Inflammation in the Anterior Segment of the Eye. And this was co-chaired by Reza Dana and Nita Shin. And for these workshops, various program officers in the extramural division put a lot of effort into helping not just the cornea or anterior program officers, but ranging throughout the whole region. Everybody chipped in to help. And program officers that helped with the immune system eye health were Sangeeta Bhargavar, Natalia Gordienko, and Kamal Miraj. And in this workshop, they cover topics for immunology in the eye, ranging from homeostasis to resolution, including senescence and aging. And they covered aging microbiome and the environment, neuroimmune interactions, and the overall goal is hopefully to develop targeted therapies for inflammation, besides just grabbing the over-the-counter steroid, but grabbing a specific anti-inflammatory agent that you need. And there was also a microbiome workshop that was held, and the co-chairs for this workshop were Russ Van Gelder and Karen Nelson, and two of our program officers who worked really hard on this was Lisa Newhold and Marianne Redford, and they were looking at and Dr. Chang talked about this in greater detail, but they're characterizing the microbiome on the ocular surface and examining how microbes residing in other parts of the body affect the eye. And as he mentioned, there's an RFA that's out on the street now.
RFA-EY-22-0001, Community Research Resource, Characterization of the Resident Ocular Microbiome, U24 Clinical Trial Not Allowed.
And white papers for both these workshops are located on the NEI homepage if you're interested in looking at them to get more detail about them. And the last thing I just wanted to mention was just recently, there was a paper that came out where an investigator has collected tears on Schirmer tear strips, and has been able to do mass spectrometry and looking for proteomic analysis of this tear fluid. And he's been able to analyze over 3,000 different proteins in the eye. And he's hoping in the future that they can use these as biomarkers for everything ranging from dry eye to Alzheimer's disease. So this relates back to the NOC that we put out, which is interesting.
Slide, NIAMS Accelerating Medicines Partnership, or AMP, Autoimmune and Immune-Mediated Diseases, or AIM.
The last thing I want to mention is the NEI just recently signed on to a partnership with the NIAMS Institute. It's Accelerating Medicines Partnership. And in the first bullet point, you can see there's a bunch of different groups that organize this Accelerating Medicine Partnership. And this was, let me back up and say.
The NIH, the Foundation for the NIH, the U.S. Food and Drug Administration, pharmaceutical companies, and nonprofit organizations.
There is a component of this partnership, the Autoimmune and Immune-Mediated Diseases, AIM, or that's what they call it, AMP-AIM. And there in the Autoimmune and Immune-Mediated Diseases component, there are four different immune-mediated autoimmune diseases we're looking at, and one of them is Sjogren's syndrome. So the NI is specifically interested in the Sjogren's component of this. And overall, this partnership, there's a microbiome technology and analytical center hub. And in this hub, they take the microbiome from oral, skin, and gut from the Sjogren patients and normal patients. So we're hoping that by us partnering with this group, that we can collect biomarkers from Sjogren's patients and microbiome information to contribute to our microbiome RFA that we have out.
Slide. Thank you.
And I'd be happy to take any questions.
Logo for NIH, National Eye Institute. Research today, vision tomorrow.